Yes, my name is Bahar Mehmani, and I would like to give you a little bit of a background of the study. So, as Melina mentioned, we were all constrained by the pandemic, and early on in the lockdown situation, there has been some considerations being voiced by editors and researchers about the impact on women academics because of the homeschooling and care duties. And so I'm going to give you a little bit of a background of the way that we take this into account, and started to analyze our data and share you the scale of our data, the results, and concluding with some remarks. So this is a study in collaboration with three of my co-authors, Professor Flaminio Squazzoni, who is a social scientist from University of Milan, Professor Francesco Grimaldo, who is a data scientist from University of Valencia, and Professor Giangiacomo Bravo, who is a statistician at University Linnaeus. And I have put a link to the study, which is now available on SSRN. So if you're interested in knowing more detail about it, please feel free to check it out over there. What we did was to look into all Elsevier journal submission and peer review data in the weeks of 6 to 22, basically from February to May, and in comparison months of 2018 and 2019 to see how women and men submitted their manuscripts and what is the change in between these 2 years, as well as the review invitation acceptance rate. I have to mention that in our submission systems, we do not ask researchers to identify their gender. So what we did was to run the names of these data points to dictionaries of names and gender guessers, and we assigned the gender based on what we found out. Of course, there is a limitation in here. We are only able to check for the binary genders, and we're not able to distinguish non-binaries. So that's why our separation is based on women and men. We could see that women have submitted almost 2 million submissions, 1.9 million, and men have submitted 4.4 million submissions, whereas for the review activities, we could see that women are being invited to review less than men, and that's normally the trend in across all the subject areas. But in general, the review acceptance rates seem to be quite close between men and women, around 56.5%. Now, in order to give you the scale of the study, I'm showing you here in this table the number of journals we looked at in different subject areas. You can see that Elsevier has 896 journals in health and medicine, which is the biggest portfolio. And then we have 417 journals in life sciences, 770 journals in physical sciences and engineering, and 264 journals in social sciences and economics. In total, 2,347 journals and almost 6 million researchers' data points, which was included in this study. What we found? Well, we calculated a submission difference index, which is the difference between the number of submissions per researcher in those weeks from February to May 2020 and the average of 2018 and 2019. And we found out first, in general, submissions have increased in those months. And in some fields that are very much COVID related, the health and medicine, for example, the submission rate increased exponentially up to 92%. And we could see that women across the globe and throughout different submission and different subject areas have submitted less in comparison to their men counterpart. But the rate of the peer review acceptance rate was less pronounced in terms of gender differences. In order to check for the significance of our findings, we estimated mixed effect model using the gender and seniority level for authors to predict the submission difference index. And what we found was that women across different disciplines in their mid to advanced stages of their careers have been hit harder and been penalized by the lockdown measures, particularly in the health and medicine, physical sciences, social sciences, and economics. And also to control and check for the impact on impact of the lockdown, we looked into Google COVID-19 community mobility data, which gives you an impression about the time that every mobile user has spent in different categories of areas. In this case, we zoomed into the residential areas, and we could clearly see a negative interaction between gender and time in residential areas. In physical sciences, again, and engineering, as well as the health sciences and medicine, which indicates that women, professors and doctors, who potentially are in their 30s, late 30s, in 40s, and have families with small kids, are being penalized for staying at home and the closures of schools, and due to the care duties, which are not necessarily the family care duties, but also lab care duties, are not able to finish what they have started in terms of articles and submit their articles. We could also check for the review invitation acceptance. We did the same with the models that we had, and we again saw that there is not much of a difference. Although in health and medicine, again, women are declining the review invitations more than their men counterparts. So maybe we can go to next slide. So what are the implications? Of course, given the fact that researchers are being evaluated by the number of publications and the impact of their publications, it is important to notice that this gap that is being created in the early months of 2020 is going to be widened more and more as we move forward, because less submissions will mean less acceptance and publications, and in the long run, less citations. So just concluding remarks, those who have already benefited from this COVID-19 research inflation may have higher chances in future to receive prestigious grants and obtain tenures and promotions in prestigious institutions. Funding agencies and hiring and promotion committees at international and national level need to reconsider these potential widening gaps in their policies, and perhaps they can flag or ponder or even disregard COVID-19 related publications when applicants are mentioning them in their application forms. And also, maybe they want to consider asking applicants to submit the COVID-19 impact statement to assess the publications during that period. And last but not least, I think institutions and universities can embrace some family-friendly measures in reopening policies. For example, childcare and some flexibility, so that women can get back to their pre-COVID norm of research and academic activities. Thank you.
Well, thank you very much for this little lightning talk here. Really interesting. One of the things I was thinking about when you thought about doing some follow-up interviews or something to try and investigate what is actually the root cause of it. So we have this assumption that it's probably because they have care duties at home. So they don't perhaps have the time for it. But there might also be other things that could be taken into consideration. One of the things perhaps that women, it's just guessing, right? But women might be less eager or testing out their theories before writing a paper a little bit more, or something other than just taking care of the kids.
I think that's definitely an important point. The reason we are comparing the data with previous years is exactly to also consider that if they have already been, ponderous for previous COVID-19, then you shouldn't be able to see the difference. But when you see that this is a statistically significant difference, then that cannot be a hypothesis. But indeed, because we already heard, like in case by case, by editors, by researchers in conferences, and also there are surveys going around asking PIs and early career researchers alike how the COVID-19 pandemic impacted you. And we see that in those surveys, also women and mother researchers are being the ones who are voicing the problem of homeschooling and childcare and lab care as the main burden during this pandemic. That was actually the complementary kind of study that is now available by others, actually.
So there's a question here coming in. So thank you for the talk, for the interesting talk. Has your study already reached university leaders or policymakers, or attract some attention in the media?
Yes, actually, it's quite a hot out of the oven study. We put it in SSRN 3 weeks ago, and I think it was 2 weeks ago that it was mentioned as an article in the Higher Ed. I'm very happy to present it here in this event, which has the right type of audience to make those kind of policy decisions. And yes, we are trying to reach out to everyone who is able to make a decision that can impact the imbalance that is being created. Thank you.
And we'll be following that in the coming time, then see what the impact of the study, if any, will be. So thank you so much for taking the time to come here and
thank you for having me.
About the results.